Our California hospital system is taking a major financial hit from the pandemic. Thank you for joining us this afternoon. I'm Kimberly Hunt. Adding up things such as staff, beds, and testing put hospitals at a $14 billion loss last year. ABC 10 News reporter Jennifer De La Cruz explains that despite cases going down, the financial impact on our healthcare system will continue.
At the start of the pandemic, hospitals were racing to add more space and resources, many of them still struggling to keep up with demand. Doctors and nurses were overworked. PPE and ventilators were nearly impossible to find. Healthcare leaders across the state say they're barely staying afloat.
We struggle year after year to break even. A disaster like COVID puts us firmly in the red.
According to the California Hospital Association, hospitals lost more than $14 billion in 2020, and they could lose another $2 billion this year. The financial damage may last for years to come. 447 days ago, UCSD treated some of the first patients flying in from Wuhan, China.
We've been on a full-on sprint in what turned out to be a marathon ever since.
Since then, they've invested in testing and novel therapies. They've expanded their own capacities while still sending resources to El Centro and Mexico. And they launched the state's first vaccine superstation at Petco Park. UCSD CEO Patty Mason says all of those costs are adding up.
The financial impact of COVID swept over $200 million off of our UCSD health balance sheet. Dollars we were preserving to rebuild our Hillcrest Hospital.
But things are on the right track. With cases in California lower than any other state, local leaders say hope is certainly on the horizon.
Our economy is coming back. Kids are back in school. Our Padres are winning. People are getting vaccinated. All in all, we're in a really good position and continue to do very well.
Jennifer De La Cruz, ABC 10 News.
Hospital leaders say they're hoping for additional state and federal funding to help offset their losses.